Hey guys, Danny here with the Addiction Prevention Coalition. What an exciting day right now for this Facebook Live video. We're here at the Recovery Resource Center that is in Cooper Green Hospital in Birmingham. They have so much good stuff going on, so we thought what better way right after their grand opening to come down and get this information in your hands as part of our Facebook Live video series. So we have a bunch of people that are involved up here, going to come through and just share with you and share with the community some things that they have going on, how to get involved, and potentially how to save lives. So we ask that you would share this video with your friends and family, and let's help them get the word out, because ultimately we're in this together. So today we have Dr. Mark Wilson. He's the Chief Health Officer, the Jefferson County Department of Health. So Mark, thank you for doing this, brother.
Great to be here.
Yeah, appreciate it. So let's just jump right into this. So Mark, can you tell us about the opioid epidemic in general, and I guess specifically how it's impacting Alabama?
Yeah, so I think everybody knows by now that we have a huge crisis with opioids, addiction and abuse, and overdose deaths. So nationwide and here locally, you know, more people are dying of opioid overdoses than traffic accidents, than HIV, and even homicides. So this is a public health crisis. And our health department, about 4 years ago, kind of became aware of those numbers, those statistics here in Jefferson County, where back then, like 2014, we were very alarmed at like 58 deaths in the county. But this last couple of years, we've had more than 200 deaths from opioid overdose in Jefferson County. And most of that is heroin and now fentanyl, and a few prescription drug overdoses, but that's less of a problem. In Alabama, you know, it's more than twice that number, so we're seeing most of these are in Jefferson County, partly just because of our population. And frankly, we're not really sure how many overdose deaths there are statewide. I mean, we have some statistics, but we also know that some of those are going undetected. You know, people might be, you know, dying of unknown causes or maybe a suspected heart attack, when in fact it's an overdose. It's just that it's an educated guess and we don't always know. But in Jefferson County, we have very good numbers because we have a coroner's office here that has the ability to run the chemistries on people's blood and determine what exactly it is. We don't know how many people are addicted. You know, the deaths are just the tip of the iceberg. We do know that our ambulance services or our emergency medical services in Jefferson County are administering like over 1,000 doses of naloxone per year.
Wow.
To reverse overdoses. And of course, this is a statewide problem. It's more of a problem in some areas than others, but we're very concerned about some of our rural areas, like just north and northwest of here, like Walker County and some other counties, which, according to the Centers for Disease Control, are very high-risk areas, not just for overdose deaths, but for things like hepatitis C and HIV infections spreading from needle use.
Wow. So I mean that to me is it's impressive, not in a good way.
Right.
So it almost makes what you guys are doing so crucial and important.
Yeah.
So how did the community partners arrive at the idea for the Recovery Resource Center, and how did that come about?
Yeah, so our health department has been working with several other partners ever since early 2014, after we convened a heroin summit here in Jefferson County. We called it Pills to Needles, and we've worked with several other partners, including law enforcement and including people in the addiction community and the addiction treatment community. And so we had different work groups working on different things, getting policy change, like the bill that allows us to give naloxone to laypersons now, and trying to expand treatment capacity in the community. But one of the things that one of our work groups was focusing on, as they were talking about, you know, how do we get more people into treatment, is the realization that while there are some resources in our community available for treatment for addiction, and there's a pretty good variety of types of treatment. It's really hard for the average person to know kind of how to navigate the system, and it's really daunting. If you're in the middle of an addiction and you're trying to get help, or maybe you're a family member of somebody that you know is having trouble, and you're just trying to find out where to get them help, you can spend the whole day calling around different places. You might get turned down, you might be told there's a long waiting list, or you might get in somewhere, but it may not be exactly the most appropriate treatment for your particular problem. Or, it may be that they need a lot of money up front, or they require certain insurance. And, we know a lot of people, once they get into that downward spiral of addiction, they're out of money. They've lost their job. They've lost their health insurance. They've burned a lot of bridges. So it's just really, really hard to find your way into treatment. A lot of people do, but we just realized that we needed to really help people navigate that. So we thought about just having like a website. The Addiction Prevention Coalition has a great list on their website. We thank you for doing that. And a lot of different phone numbers you can call. We thought about having a navigation tool, but we decided in the end that we really wanted somebody to be there in person to help you if you need help, and to help you get the information you need, help do an assessment, and just help navigate along the way. So several of our partners came together and came up with a plan, and we've been working on this for over 2 years. But a lot of our great partners, UAB Task Program, Fellowship House, and several others have been working together to come up with this plan. And our health department is the main sponsor, sort of providing the backbone support. We turned to the Crisis Center of Birmingham because they already had 24/7 call coverage, which we wanted to have. And as we looked at it more and more, we thought, the Crisis Center does great work, and we think they ought to just run this. And so that's where we are now. The Crisis Center of Birmingham is running this program, and with, again, a lot of help from our partners, especially grant writers at the Department of Mental Health and at UAB, we've gotten some additional grant funding to even build it out beyond what we originally planned.
Well, that's great. And you touched on something really important that I'm a big believer in. Everyone needs something different.
Right.
So the more we can come together as a community and pool our resources and say, our ultimate goal is to help people,
right,
and to save lives.
Yeah.
So I commend you guys on that. And you have a naloxone kit.
Yeah, I just wanted to show everybody this. I almost dropped it. Our reflexes are still pretty good. Yeah, so these are opioid overdose kits that our health department is providing. We also have a supply coming from some grant money that the Alabama Department of Mental Health got. And just so everybody will see, these contain 2 doses of this naloxone, or Narcan nasal spray, which is real easy to use. And this will reverse an opioid overdose. So we're giving these out for free to anybody who thinks they might need them. If you're a person with addiction, or maybe at risk of relapse, or somebody, or you're around people who may be at risk of having an overdose, we want you to have one of these. So thanks to our partnership here, we are now offering trainings at this location, the Recovery Resource Center, on the 4th Wednesday of every month at 5:30 right here. So, and that's tonight if people want to come. We want them to call ahead. Is that right, Leslie? Yeah. Just so we'll have an idea how many are coming. But we'll be training people on how to use these and then giving them out. So just want to make everybody aware of that.
Now, does someone have to be a resident of Jefferson County?
Yeah, so we're going to actually have, ordinarily that was the case, but now because we also have some coming from the state, we'll have a variety. So we can help you even if you're coming from outside of Jefferson County. So that's been very helpful.
Oh, great.
We'll have 2 different versions.
Well, Mark, you've been involved with the APC for many years now. You've been a friend, so I just want to commend you on all your work. You're out there making a difference, so thank you so much.
Yeah, and we really appreciate you, Danny, and what you all are doing as well.
Thank you so much. All right, well, we are going to shift gears, and we're going to hear from peer support specialist here at the Recovery Resource Center. His name's MJ. Come on in.
Hey.
This is MJ.
Hey, everybody.
So he's a peer support specialist, as I said. So we're just going to jump right into this, if you're ready.
Yeah.
So tell us about your job here at the Recovery Resource Center.
Well, I'm a certified peer support specialist. That requires a certification through the Department of Mental Health. There's possibly other routes to get certified. But basically what I do is sort of like a counselor, but I'm not a clinician. At the Recovery Resource Center, I'm the first to greet the client and the last to see them out and discuss their options. My main tool and my main use in counseling is my story. I've been through addiction. I started drinking when I was 14 and went through addiction, but I've been through recovery. So I know what it was like on both sides, and I've been able to be sober for 9.5 years.
Congratulations.
So I know what it's like to stay sober for a little while. And I use that story to help the client. I'm not above them. I'm on a peer level. I'm on their level. So that's what I do here.
Great. So tell me why you like working here. Why are you passionate about this job beyond your story? Obviously, you want to help people. You want to give back. Just share your heart with me a little bit.
Well, I do like helping people, which is not something I ever dreamed would inspire me and give me a sense of purpose. Because in my addiction and before, when I was young, all I cared about was myself. I didn't care about anyone else. But it's part of how I stay sober. It's part of how I stay clean, is helping other people. And it actually gives me pleasure to help people today. And I know we're going to help a lot of people here. And I've already been able to help a number of people. So it really gives me a sense of purpose.
Well, great. Well, MJ, Michael, thank you so much.
All right, Danny. Thanks for having me.
God bless you for what you do.
All
We're going to
right.
switch gears, and we have Leslie, who is Leslie Playa.
Yeah, good
Hey, got it right. She is the director of the Recovery Resource Center. So we're going to jump right into this.
Yeah.
And so what services does the RRC, and I try to do that not in my Boston accent, because nobody would know what I was talking about if I said RRC.
Yeah.
So Recovery Resource Center, what services do you guys provide to the community?
Well, thanks for having us, Danny. So we provide peer support like MJ was talking about. We can also provide the state assessment that is needed for most treatment centers in Alabama. We can also provide linkage to treatment as well. So if somebody comes in and say they have an opioid use disorder and they would like medication-assisted treatment, which is an avenue that some people go to, we can make appropriate referrals for them. If somebody has insurance, we can hook them up with the correct treatment provider. If somebody wants faith-based services, if somebody wants state-funded, if somebody doesn't have money, has money, whatever, we can help get them to the resources that they need. And it's not just treatment that we're looking at. If somebody is homeless, we try to get them into appropriate shelters. If we know that they have some mental health issues, we want to try to get them hooked up with the appropriate medical services if that's something that they need. Mm-hmm.
That's great, because, for me, being a person who has been to many rehabs, the one thing you want is somebody to talk to.
Mm-hmm.
And I think people that are watching this who have tried to find help, our resource director is great, but when you can talk to someone face to face and you have a place to go, I mean, that's amazing. So
I definitely agree with that, because we can have people, if somebody walks in, they don't automatically have to say, hey, I want to go to treatment, I need help. They might come in and say, you know what, I feel like garbage right now, and I feel like nobody understands. Can someone just help me and someone just talk to me? And that's what's so wonderful about our organization, is that we do have these peers and people who are in recovery that can sit down with someone and say, man, you know what, I've been there. You're not alone in this. And what happens too is if somebody does decide that they want to go to treatment, we're going to follow up with that person on a daily basis until they get into treatment. For some places, there are really long waiting lists. It's kind of what's just happening in Alabama right now in general. So we're going to follow up with them on a daily basis and make sure that they know, hey, we're still in this with you. You're not alone in this. And then we're going to continue to follow up on an incremental basis after that.
That's great.
Thanks.
That's amazing. So how does someone, I'm outside right now, I walk in, how do I access this program? Do I just walk through the door? Do I call you? How's that work?
You could do both. We do have people that walk in. We do have individuals. A lot of family members will call and say, hey, what do I do with my loved one? And we'll say, here are some boundaries you can set, or if you know that you want them to go to treatment and they're willing to do so, just bring them in. Sometimes we like a heads up, but it's okay if you just walk through the door too.
Wow, that's great. So, okay, so I'm that same person. I just walk through the door.
Mm-hmm.
Now tell me what that process is like after I get treatment. How does that all tie in?
Okay, so when somebody walks through the door, they're immediately hooked up with a peer. So someone like MJ or one of the other peers on staff. And they'll do a series of assessments and intake paperwork on our end just to figure out what this person might need. And so if somebody's homeless, if someone has been in a domestic violence situation, if someone is suicidal, we want to know all of that so we make sure that we give the appropriate referrals. So after we do our intake portion, then the state assessment is done, and that's the ASAM that I was talking about earlier. We have a lot of community partners who volunteer their time and come in and provide the assessment for us. So that assessment is completed and specific recommendations are given to the client. So afterwards, those recommendations are also communicated to the peer. And so the peer and the client, they sit down and say, hey, this is the plan. This is what we're going to do. These are the next couple of steps. You have to make sure that you get on the waiting list of that organization. You need to call every day and just lining up those specific appointments. But then on our end, we also do the same thing. So we're not just relying on the client to make those phone calls. We're going to follow up too and make sure the assessment got there, make sure that they're on the waiting list. So after those recommendations are given and the plan is put in place, the client will leave and then we start contacting them the next day. So we're doing some work on our end to make sure that the providers have exactly what it is that they need, and then we're reaching out to the client on a daily basis. So we're also going to give the client recommendations about different support groups as well. So it could be church, other recovery groups, whether it's secular or not. We want to make sure that people have those resources so they don't feel alone. Ross is another great resource. They're a peer support organization, and they have a lot of activities at night and on the weekends, and we refer to them as well.
Okay, well, great. So tell me how somebody watching right now, they want to get in touch with you. How do they get in touch with you?
So they can call us at 458-3377. That's 205-458-3377. And so if you are a client or if you want to volunteer, we love volunteers. We just launched a 24/7 hotline in conjunction with our amazing partnership with the Crisis Center. And so any individuals who are in recovery or who are certified peer support specialists who would like to volunteer for that, they can call as well. So that main number, the 205-458-3377, is the best way to get in contact with us.
Well, Leslie, thank you so much.
Thank
It's
you.
been a pleasure.
Yeah.
MJ, thank you, and Dr. Mark. So guys, stay tuned for some more Facebook Live videos coming up in the future with other great community partners like the Recovery Resource Center. So we'll see you next time.